Hello, I'm Dr Mick O'Keefe, Chair of the College's Working Group for the pilot of Entrustable Professional Activities in Community Child Health Advanced Training. During this presentation, I'm going to describe how to use Entrustable Professional Activities within a Community Child Health training rotation. For the duration of the pilot, the learning plan and the supervisor's report will replace the learning needs analysis and the final supervisor's report that are currently being used. So this means that trainees participating in the pilot don't need to complete a separate learning needs analysis for the rotation, and also supervisors only have to complete one final supervisor's report, which is the new one being trialled. So we're not going to be drowning you in paperwork. At the beginning of the training rotation, the trainee and supervisor should sit down formally and complete part one of the learning plan and supervisor's report. Part one's all about negotiating learning goals, and that includes choosing the entrustable professional activities to be targeted during the rotation. In addition to those EPAs, the trainee and the supervisor should decide on any other learning goals that the trainee would like to meet. The trainee and supervisor then put their heads together and plan the learning activities that the trainee could undertake to help achieve those learning goals. Throughout the training rotation, the trainee should focus their learning towards these goals. And this may include organising workplace-based assessments to prompt a supervisor to observe them undertaking part or all of an entrustable professional activity. It obviously also involves reading around the topic, practising the skills involved, reflecting upon one's performance, arranging to watch a senior colleague perform the task, and so on. At the midpoint of the training rotation, the trainee and supervisor should arrange another formal meeting to discuss progress towards the learning goals, including progression towards the targeted EPAs. During that meeting, the trainee and supervisor should determine if a trainee is on track and also decide if there's any new actions that need to be taken before the end of the training rotation in order to achieve the learning goals, including the EPAs. At the end of the training rotation, the trainee and supervisor should meet again to review the trainee's progress throughout the rotation, including a review of progress in the entrustable professional activities which were nominated. During this meeting, a final assessment is made for each of those EPAs to determine if these will be certified as achieved. Each entrustable professional activity includes descriptions of expected performance at different levels of proficiency. This includes what we've called core level, and that is the minimum expected performance for all community child health trainees across each of the core areas, as well as for more advanced levels of performance. Trainees participating in the pilot will obviously be at various stages of their development. The entire list of EPAs should be considered as a goal to achieve before completing advanced training in its entirety. So it'd be crazy to expect trainees to reach entrustment point for all EPAs during this 6-month pilot. So instead, during the pilot, what we're asking is a reasonable sample of EPAs relevant to that training rotation to be the ones road tested. When making entrustment decisions, the supervisor should use a range of evidence. And this could include directly observing the trainee carrying out the task, observations made during workplace-based assessments like the mini CEX or the case-based discussion, obviously our regular clinical conversations that we have with the trainee on a daily basis, or feedback from colleagues. Information sheets have been developed for each entrustable professional activity that contain a description of the expected performance standards for each one, as well as a guide on relevant assessment methods. Entrustment is achieved when a supervisor trusts the trainee to complete that activity independently with only reactive supervision, which means where a supervisor can be consulted if necessary, but they're not there looking over the trainee's shoulder. Completed learning plans and progress reports should be submitted to the college at the end of the training rotation. For further information on the pilot of entrustable professional activities in community child health, please refer to the college website.